And as time goes on, perfect, good. I'm so glad that we're getting this recorded tonight. As time goes on, more people will be able to trickle in. There was a little bit of scheduling conflict with tonight. I know that many of the medical students who participate in the RAP Venable program currently have a fireside chat for tonight. So it's really good that we're getting this session recorded just so that we're able to provide this session for a lot more people. So once again, everyone, my name is Dr. Aaron Douglas Dotson. I'm born and raised Los Angeles, California, finished up medical school at St. Louis University School of Medicine, and I'm now a PGY2 at the University of Iowa. It's an honor to be here. I'm so glad to see some familiar faces, and we're looking forward to talking with you all tonight. Let's see, would Derek like to go next just to introduce himself?
Sure. Hi, everyone. My name is Derek Ansa. I'm currently a PGY2 in ophthalmology at the University of Rochester in upstate New York. I was born in Ghana, grew up in like around Silver Spring, Maryland area, and did my undergrad at University of Maryland, College Park, and then went on to med school at Johns Hopkins before applying and entering into the field of ophthalmology. It's great to be here tonight, and hopefully we can get a lot of your.
All righty, Belinda, would you mind going next?
Hi, everyone. My name is Belinda Ikpo. I'm a PGY2 at Albert Einstein Montefiore Medical Center. So I'm originally from Pennsylvania, grew up there, did my undergrad at Hopkins, and then came back to Pennsylvania to do my med school at Penn State. And now I'm a PGY2 in ophthalmology, which has been a fun journey so far. So excited to continue on that path.
Wonderful. And then Dr. Randolph.
Hi, good evening, everyone. Thanks for having us. I'm Jessica Randolph. I'm a retina specialist, retina surgeon at Virginia Commonwealth University in Richmond, Virginia. I went to medical school at VCU and did my residency, and then I did a retina fellowship in Houston, Texas. Then I was in private practice for a couple of years, and now I'm back in academics at VCU. So I look forward to talking with you all and answering your questions.
Wonderful. And then Lynette.
Hi, everybody. Lynette. I'm a PY4 in ophthalmology at Virginia Commonwealth University in Richmond, Virginia. I went to Howard University for my medical school, and currently I'm here for my residency. And I'm currently also applying for retina fellowship. So please feel free to ask any questions. We will be glad to answer any questions you have.
All right, and I'm not sure if Dr. Lola I is on the call right now. But that's okay. She may be coming in a little bit later. So the purpose of this talk tonight is going to be to discuss kind of the ins and outs, as well as tips, some things that we wish we would have known when it comes to applying for residency in general, specifically for that of ophthalmology. So I guess I can start off by asking a few questions for some of our panelists here tonight. As you know, as we'll probably tell you plenty of times, and many times, ophthalmology truly is the best specialty in medicine. There's so many different things that we love about ophthalmology. But I guess in particular, what is some advice that, or something that you wish you would have known when it came to applying for residency, interviewing for residency, et cetera? Anyone can take on this question here.
From me, I'd probably say I wish I knew about the field sooner, because I actually found it kind of further along in my medical school journey. So my first actual ophthalmology rotation was the first rotation of my fourth year. So at that point, I'm just oh man, I wish I would have known things sooner, so I could have helped push myself along the way more towards ophthalmology. But I say that to say that even if you were interested in things before, or you did research and things before, that's still an asset to you if you do choose to go into another field outside of what you originally thought you may do. So that's probably one thing I'd mention.
Yeah, I can piggyback on that. I also didn't discover ophthalmology until sort of late in my third year. And so I was kind of scrambling to figure everything out with it being an early match. So the sooner that you know, or even if you think you might have an interest, then it's worth it to shadow or do some research or something to pursue that, to see if it's really something that you're interested in. Like Dr. Dotson mentioned, ophthalmology is an amazing field, and I think we all will tell you how much we love it very easily. I know for me as a retina specialist, I see fewer kids, but I could see kids. I see adults of all ages. I see acute problems. I see chronic problems. And I do surgeries and a lot of procedures and lasers and injections. So for me, clinic is very variable and varied in terms of what I'm seeing. It's not kind of the monotony of some other fields. And I like having patients that I see long term and really establish a relationship with. And then I also have patients where, I see them a couple of times and then, I've done what I need to do for them and then I don't see them anymore. So it's a really good variety for me. I also like telling patients, this is how I'm going to fix you. So as a retina specialist, it's like, I'm going to do this surgery or this injection or whatever, and that's going to be how we fix it, as opposed to some other fields where it's kind of more of a negotiation and like every visit is a long discussion of suggestions that may or may not get followed. It's for us, it's kind of like, we should do this if you want your vision back. And most people say, yeah. So I like that aspect of things a lot.
I guess for me, kind of going along with what everyone else also said, one thing I do wish I had more exposure to all the different kind of subspecialties in ophthalmology. I mean, they were all available at my medical school, but I kind of just picked one because, I mean, you don't have as much time in med school to kind of explore all of the different ones. But I do wish I had a chance to see all of the different specialties before going in because, I mean, now I'm still like interested in a whole lot of different things, seeing it for the first time, like oculoplastics, for instance. A lot of my experience in med school was like focused on cornea, which I'm still kind of interested in doing. But just getting a chance to get that like broad sense of what ophthalmology really is, because it's a lot more broad than one would think from just like having a few weeks rotation in med school.
All right, guys. I think that's definitely wonderful answers there. I guess my next question is, pertaining to residency, there are so many things that go into play when it comes into finding a resident that fits in well with the program, et cetera. But what are some essential qualities that you think an incoming applicant should have when it comes to applying for residency? Or basically, what qualities make a strong resident and will help increase a person's chance of getting the interviews as well as matching at their dream program?
I think from my point of view, being a resident and now being in my last year of residency, I have seen a couple of med students rotate through our department. And we know that you don't have the knowledge, and that's not what we're looking for when you come through the rotation. We want to see someone that it is reliable, that is proactive, seeing patients and wanting to learn about the disease process, the treatment. We want students that they're willing to help us with call, and we definitely see that. We see that you're a hard worker, and that's what we want. Someone that it's not only hardworking, but is also put the patient first, and has, that is the main goal. So I think being a resident, one of the main things will be to get a resident that is a hard worker.
Absolutely. I think I can definitely echo with that. I think in residency in general, we want people who are going to be extremely passionate about their field, because I'm not going to lie, it's like, as much as we love and adore ophthalmology, you're going to have days that are going to be amazing and very fulfilling. And you're going to have some of those days where you get that one annoying patient who may tick you off for the rest of the day. Yeah. But when you have that passion and drive inside of you, It's those good days that become so much more memorable, and that becomes just so much more just better overall. And it's those not so good days that really, they're not as bad if you truly do love and adore what it is that you do. You know, we want people who are hardworking. We want people who are organized. Ophthalmology, I feel like, is a little bit maybe less of a team sport compared to internal medicine, where you're rounding as a team, you're doing this, you're doing that. But still, to some extent, you have to be a team player, because you're going to be the one taking care of patients. You're going to be the one ensuring that a patient gets follow-up. You're going to be the one working with your senior resident, what you're attending when you're in surgery, et cetera. So I think these are all very essential qualities. But I think what's most important is that you have to have clear-cut examples either on your application or when you get ready to interview that help to show that you have X, Y, and Z qualities. So for example, if you're saying that you are a hard worker, that you are a leader, be able to provide an example of how you are a hard worker, of how you are a leader, et cetera.
And also, now that you mentioned that, I think it's very important. In your personal statement plays a big role in the application process. And I think all my interviews, they always ask me about my personal statement and the relevant things I said in there. So definitely include your qualities in your personal statement, and they're definitely going to be drawn to it. And it's going to be a topic of discussion during your personal statement, and also let them know about your qualities.
And just to further go on that a little bit, like, we know why ophthalmology is great. So please don't tell us why you like ophthalmology in your personal statement. Tell us why you are a good fit for ophthalmology. Like we've said, talk about why you are a good leader, why you are a team player, why you are passionate about ophthalmology. Like, we all know what makes ophthalmology great. We're ophthalmologists. And so a lot of people spend a lot of time talking about, you know, how cool it is to do surgeries, or their grandma had cataract surgery and she could see again, or, you know, you had a pediatric eye problem when you were little. There's actually a paper about that, and most personal statements fall into like 3 sort of archetypes. And it's like the eye problem, the technology is cool, and I forget what the other one is, but like, try to be different and really tell us about yourself. And with this year's application, they've changed the personal statement instructions a little bit to sort of get that from people. So instead of it just being a blanket personal statement, it's actually there's like a biographical sketch or something, I forget what they call it, which is really supposed to be like, tell us your personal history. And then there's a couple other ones where you were supposed to describe like when you were a leader, or when you know, there's like 4 or 5 prompts, and I think you pick maybe 2 of them and write like a couple paragraphs about them. And so it's really designed, like, we're trying to push that direction where you're actually telling us about yourself in these personal statements, instead of sort of telling us why ophthalmology is great, because we know that already. We want to get to know you. You know, your application, we should read it and be like, oh man, that sounds like a really cool person. Like, I want to get to know them more. I want to work with them. They sound like somebody that I could trust to call me in the middle of the night. You know, those are the sort of things that we're looking for. And like Dr. Rodriguez said, it's hard as a medical student because you don't know anything, and we know you don't know anything. But like, as an example, I was in the OR today. And so for me, when I see the medical student figuring out where the light is, because I do lights on, lights off a lot for retina stuff. So if you know where the lights are and you're the one that turns them on and off, or you know that they need ointment at the end of the case, and so you have the ointment ready before I can ask for it, you know, little things like that where you're helping and you're paying attention, even though you're not expected to know how to do anything in an eye surgery, but you know, you're putting forth that extra effort to be helpful in some way, then it shows me that you're really, you know, putting the effort out there and trying, and then hopefully going home and reading about stuff and asking good questions, and you know, paying attention and asking questions about the things that you're seeing and the patients that you're seeing, and learning so that by the end of the rotation, you know more than you did when you started. Those are things that I'm looking for in students.
And I guess just to quickly add on to that, in terms of like attributes in general, make sure you ask ask letter writers who can speak to those attributes as well. Because it's also one thing to have in your personal statement, but if you can have a strong letter writer who can then add to what you've already spoken in your personal statement, that goes miles for you.
Yeah, one thing I'll mention about that is make sure you ask your letter writers if they feel comfortable writing you a strong letter of recommendation. Don't just say, can you write me a letter? Can you write me a strong letter? And when they say yes, send them an email with, I would like you to focus on these things. Here are some of the things that I feel really passionate and important about from my application or my CV, and kind of give them things to work with. You know, even students that I've worked with a lot, it's still kind of hard to write a good letter because I'm like, I wonder if she wants me to talk about this or that, or, you know, they've done other things that I don't even know about that are really cool and that I learn about later, you know, during the application process. So try to give your letter writers clear goals, clear guides. Some people will even have you like write a bare bones letter for them as like a starting point. And so, you know, you really try to like guide your letter writers in the direction so that you get the best letter possible, because it really can make a difference. We can tell when we're reading them, the ones that are like, yeah, the student was all right, sure, you know, and it's a good letter. They didn't say anything bad, but it's different than the one that's like, I know and I love this student. I would take her in a heartbeat. She's really amazing. She did all these wonderful leadership things. And she, you know, and she walked the walk and talked the talk when she was with me on rotation. So be very clear with your letter writing goals.
And in terms of qualities, I think another additional thing I would add is kind of like how everyone mentioned, that motivation, especially motivation to learn. Just the learning curve in ophthalmology is really steep, especially in the beginning. And it's a large part of that is due to the fact that you don't really learn much of ophthalmology in med school at all. And so you have to really be self-motivated to learn all these things on your own, to do the reading, study up on the patients that you're seeing. And I think one way to kind of show that in your application is also by doing a lot of different activities and showing that you can juggle and handle, like multitask and do multiple different things at once. Because that's kind of how residency is. Especially early on, you're learning how to do all these new techniques while also learning like the pathology and the actual diseases of what you're even trying to see in the first place. So it's a lot of juggling and balancing. And if you're able to do that with like your research and kind of the things that you're learning in med school and showing that you're well balanced in that sense, it kind of bodes well for residency as well.
Yeah, you guys, I think those are all very wonderful responses. I do see this question in the chat with regards to how important research is when it comes to applying. Before we get to that question there, I do want to say for your application, my biggest piece of advice is do not discount yourself in regards to your service things that you have done throughout medical school, with regards to your hobbies and the things that continue to make you unique. We always hear within these competitive specialties that, oh my gosh, step score, research, letters of recommendation, da, 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 da. But it's like, at the end of the day, I think a lot of people want to know, what is it that makes you human? For me, I'm a classical pianist. I put that down on all my applications. You know, I enjoy playing volleyball. I enjoy traveling. I'm not the best at cooking, but I enjoy food. Like, if there is something that is a hobby that you love and that you're passionate about, put it on your application, because that is another conversation starter when you do go to your interviews. And also, you know, when it comes to doing service opportunities, that there's so many different qualities within doing service. It shows that you are passionate, you are committed, you are wanting to help underserved and disadvantaged communities, and so much more that you can absolutely talk up when you are at your interview session. So I want to pose this question to the group here. You know, how important is research when it comes to applying to ophthalmology residency? And also, like, does it need to be ophthalmology specific research, or can it be something else?
I think like one of the big benefits of doing research as a med student is that it's kind of the one way that you can show your passion and interest in ophthalmology. And it is, especially if you're entering like later on, it can be hard to get into like ophthalmology research projects. But even doing things like a case report or something small like that, just to show that you have some kind of interest in the field, and to be able to express that to the program directors and the people that are interviewing you. And it could be something that, even no matter how small like that project is, it could be something that could introduce like a conversation during your interview. And it could be, for all you know, something that the interviewer is working on as well that you guys can talk about.
So I think research is very important in that you have some. It doesn't have to be some crazy clinical trial, it doesn't have to be hardcore bench research. It doesn't have to be, crazy in its like depth or length of time, but some sort of research to show that you have research teaches you certain things. And so you have those skills, you can perform research, you know how to make a research question, you're familiar with the IRB process, all of these little things that doing research teaches you. And it does not have to be in ophthalmology. It certainly is helpful if it is, for one reason, because it helps to solidify that you actually like ophthalmology. I thought when I was a medical student that I was going to do radiation oncology, and I did a bunch of research in radonc, and then I was like, nah, ophthalmology is way better because you get to cut people in the eyeballs. Like radonc, you don't get to cut. There's not enough blood and guts over there for me. And so, but I learned a lot about radonc doing the research that I felt comfortable being like, no way, I'm going to make this last minute switch and apply, last minute to the early match, and sort of throw all my eggs in a totally different basket. From what I had originally thought. And so, it also just shows like drive and like, I think Dr. Ansa said, like juggling different things and having time for, making time for both studying and doing research shows that you can handle the workload of ophthalmology residency. And it shows that you're driven. You can find a research project somewhere. Someone will help you do a project, even if it's a case report, or there's the eye wiki. There's like a Wikipedia for just eyes, and it counts as a peer-reviewed research project. And it's something that you can easily knock out in like a week or less. And so, there's kind of no excuse to not have research. When people don't have any research, to us, it's more of a red flag. Then necessarily, like, we're not judging the one research to the like versus somebody with 10 research projects. It's like, do you have it? Yes or no, generally speaking. And then, like was mentioned, it is a talking point on interviews and stuff like that too. So I definitely would recommend some sort of research. And it does not have to be in ophthalmology, but it certainly can help if it is.
All wonderful things. And actually for Dr. Matthews, I've been getting some messages from some of my mentees. There's a few people that are waiting in the queue to come into the room. So if possible, we can try to let them in. With regards to the research, just to kind of tie things together there, I have research in urology, not ophthalmology related. In general, it was just within urology. I think that a lot of residency programs are very understanding in that many of us don't discover ophthalmology until later on, because as we keep telling you guys, certain programs give you early exposure, but most programs are not going to give you early exposure. Regardless though, research continues to show that you are able to finish something that you started. It shows that you are disciplined. It shows that you are diligent. But the key thing is that if you put something on your application with regards to research or whatever it is, be prepared to talk about it, because many people ask me about my urology research and I had to be able to talk about it. It's going to make you look bad if you have it on there. You're just like, well, I don't know what this project is about. So what we can do is we can continue to chat about different aspects of the application process. We can open up the floor now for any other questions that you guys have. Looking at the Sfms Timeline, I believe the current fourth-year medical students, they should have either already submitted their applications or be very close to submitting their applications for this cycle. Looking at the Sfms Timeline, things opened up on July 1st of this year. September 1st is like the targeted deadline, and the match results will be ready for on February the 8th, 2022. But I want to open it up to the floor for you guys. Are there any other questions that you guys have right now?
While we're waiting for questions, I'm just wanted to say, make sure you find a mentor. There are a lot of people involved in like the NMA or that have connections to ophthalmology that can help you. It doesn't necessarily have to be an ophthalmology person, but again, it can help a lot if it is. And having a mentor is really, really important. They can help you by looking over your CV, they can look over your application, your personal statement, they can help you find research projects, and theoretically even write you a letter when the time comes. So if you're considering ophthalmology, and I see there's a couple M4s on the call, but people who are younger in medical school, the M1s and the M2s, start now. Find someone, at least at our program, between M1 and M2, you actually have a break, you actually have a vacation, and that's like a clutch time to get some research done. But if you don't know anyone and you aren't connected with the department, then it's a little bit harder. So go ahead and reach out and find someone, shadow them if you think you might be interested in ophthalmology, and all those experiences can help sort of solidify your desire for ophthalmology and your application in general.
So I see the question in the chat here. Is there any advice that we can give for international medical graduates? And if not, that's okay. So my advice that I would give is that to be an international medical graduate and match successfully into an ophthalmology residency program, I'm not going to lie. Is it a bit more difficult? It absolutely is. But can it be done 100%? It can be done. You may have to do a little bit more research with regards to looking at the current residents of various programs around the country. I would personally highly recommend that if you find current residents who are international medical graduates, do your best to try to reach out to them directly and see what was it that they did that helped to increase their chances of successfully matching into an ophthalmology residency program. For a lot of our international medical graduates who apply, they're very well-rounded individuals. They've done their homework. They in most cases, they have done additional things. They've gone the extra mile to show that, they are wanting this more than anything else within the world. So I feel like that's one suggestion that I can give is try your best to reach out to those who are currently at a residency program who may be an international medical graduate.
Yeah, I don't have any other specific recommendations. You just, like Dr. Dodson said, everything is spot on. You're going to have to work a little bit harder making those mentorship connections, maybe even away rotations where that the places are accepting of international medical grads. Some places are a little more open to it than others. And so you may not want to waste your time with somewhere that's never taken an international medical grad, or, if they don't seem warm and fuzzy when you're corresponding with them, then maybe don't waste your time, trying to do an away there or things like that, rotating there. So it's going to be a little bit tougher battle, but it definitely can be done. But I would, again, just try to find a mentor, somebody that can help you and sort of give you that kind of insider information about who to talk to and places to go and how to work that angle so that you can get a spot.
All right, so we have another question in the chat here, which is, it's very relevant. We really are in this kind of weird limbo when it comes to pass, fail for step one versus people still applying when it comes to scores. So has any of you guys' residency programs talked about how they're going to emphasize step one, how they're going to emphasize step two, or other important factors for the residency application?
So I don't mean to be answering all the questions, but I can.
I think I can make some comments about it.
Okay.
I think that now, since we're moving more towards pass, fail, and not in a specific score, I think the panel is looking more to in a holistic way or an integrative way. So they're trying to put everything together. So now we don't have a score to rank you, but I think there are other areas in your application that you can definitely stand out. Like we said earlier, the personal statement, activities you have done. I think now they may be putting more emphasis in the score for the step two, especially the CK, the clinical knowledge. because the CS is just pass fail. So they may be putting more emphasis on the step 2 and definitely try to stand out in other areas of the application other than the step scores.
Yeah, it's kind of a tough spot for us who are on application committees, because we will receive hundreds of applications per spot. So like our program is now 4 slots, and we will receive like 600 applications for those 4 slots. And so we a lot of times use numbers as a cutoff system so that we know that we're getting, kind of people in the middle of the pack, at least at our program. It's hard if you have a poor step 1 score. A lot of places use cutoffs just to decrease the volume, because it takes a lot of time to look at all of the applications. And so that's why the numbers are useful for us on the committee. That being said, the numbers are, and this is my own opinion and not of anyone else, blah, 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 but the numbers are garbage, because we know that minority students and women are going to score lower on them than are their white male counterparts. And so if you look at the averages of the numbers, it's higher, also higher for people in higher socioeconomic statuses. And, if your parents were doctors and things like that, and that's all because of access to resources and all sorts of things that we don't have time to get into on this talk. And so the numbers are a real sticky spot, because in a lot of ways they need to go away. But in the other hand, how are we supposed to really read 600 applications and make decisions about who's going to come interview without some sort of guide? And so using the step 2 scores will be important in some sense, but it's, again, not make or break. And I know a lot of places like ours in particular, if you know that you're interested in our program and for some reason, once the first wave of interviews go out, you haven't heard, then you can like call us and, explain your situation, reach out to the program director and say, I'm really, really interested in your program. And you don't want to do this to everybody. You want to be selective, but some places will, be more lenient with you if there's a reason to be there, or, if you have family in the area, or, whatever it is, you've had your heart set on this program for forever, then that may be a way to, get a spot where, maybe you get screened out. Or if you know that your step scores are low going in, make sure that you address that in your application. If there's some reason for it, if you had a family crisis going on or something like that, it's hard because there's no easy way to do this. And the holistic application movement is great, but we haven't figured out a way to make it efficient and not kind of super burdensome on those of us that are reviewing the application. So it's definitely a shift for everyone, not just for you guys. And, I know that as I'm involved in the AUPO, the academic ophthalmology people. And so, there's a lot of talk about it and how we're going to do this and how we're going to make this better and more equitable for everyone. And this is just kind of one step. So it's going to be some growing pains while everyone sort of figures it out. But, just like you are, we're sort of taking it day by day and figuring out how things are going to be.
Yeah, so I completely agree there too as well. I feel that I'm just going to give you guys the honest God truth here. Ophthalmology is a very small field. It's a small specialty in the sense that almost everybody knows everybody. So when we say that it's important to establish mentors at different levels within this field, it becomes even more important because your mentor might have the access and the resources and the network to be able to get you connected with the right people and the right programs who are even more willing to pull aside your application and to give it some additional time to look over. So myself, as well as Derek and Belinda, all three of us participated in the Rab Venable. Derek, did you participate in Rab Venable?
No, I didn't. I did the mom program though.
Okay. Well, yeah, I mean, that's
I did Rab forever ago, but
yeah. Dr. Randolph did RAB as well. You know, so RAB Venable is, many of you guys may know, it's an excellent program through the National Medical Association. It's the graduate level, essentially, of the Student National Medical Association. Belinda and I, we got to present our research in Hawaii, all expenses paid before COVID, but we got to meet so many powerful, strong minority individuals in the world of ophthalmology, and we gained their mentorship. Through RAB Venable, you know, I can honestly say I would not have matched and I would not have interviewed as well as I did without RAB Venable, because the people there, they were looking out for us. When they said, we are going to do everything we can to increase diversity in ophthalmology, they were not lying. And I feel that that's one of the special things about our field compared to many other fields of medicine, where they're talking the talk, but they're not walking the walk. So if you are on this call and if you're not quite ready to apply for residency, I would highly suggest, you know, get plugged in with that at RAB Venable and continue to establish those strong mentors, because you never know what an email can do for you. You never know what a phone call will do for you. And it's everything we've been talking about tonight. If you show up and show out, if you're being yourself, if you're showing that you really want to be there, people will look out for you. I promise that. So then there is another question in the chat here, which is something that I think was pretty familiar to me. You know, back in the SF Match application, there's a section that says career objectives. And it was, honestly, it was pretty vague. I looked it up on Google. Some people were like, well, just do a bullet point. Some people were like, write a paragraph. But for our current residents, like what in particular did you put for the career objectives section?
I think I put something there more along the lines of like what kind of things I'm interested in ophthalmology. And I guess I took the perspective of like, where do you see yourself in like 5, 10, 20 years kind of thing when it came to approaching that section. So I talked about some of the things that I hope to achieve later on in my career, some of the things that I'm interested in ophthalmology, and just kind of like what I hope for my career to look like, whether it's like academia or like if you have like certain research interests or like a passion for, you know, helping the underserved, whatever it is that you want your career to be, I guess is what I took that section to be.
Yeah, I was very similar. I remember like mentioning in terms of like academic, like institution, if I wanted to stay in like academia. Also like global health was like something that I was interested in. So I remember putting a blurb about like my interest in global health in that area too. Yeah, I did kind of take it more so as like, where do I see myself, or like, what do I kind of like want to focus myself on like in the future?
Yeah, I completely agree with that too as well. I pretty much put just about the same thing with regards to where do I see myself in like the next 5, 10, et cetera years. My suggestion with that is that, you know, all of us, you know, we may have had some exposures within medical school. Like I had a lot of exposure to oculoplastics. I'm not gonna lie, I still love oculoplastics a lot. And there's a good chance I might go into that in addition with comprehensive. However, you know, on my career objectives, I did not put on there saying I am looking to be an ASOPers trained oculoplastic surgeon doing academic XYZ. No, I don't want to put that. My thing is that I wanted to show that I am very open to whatever it is that is out there for me, because honestly, guys, like I love everything within ophthalmology. So I say oculoplastics right now. And I can easily end up applying into peds or neuro in a few years from now. So I think that, you know, just keeping an open mind, both on the application as well as in person on the interview is very, very important. And then next question here is that for hobbies, did you explain the hobbies and activities, or did you just add a sentence there? When we applied our year, we had a character limit and we had like a line limit on how many things you could put on your application. So you had to be very crafty and kind of sneaky with what you could put down, and make sure you put the inner mark here and make sure it looked like all nice and neat, but still had everything that you wanted. So if they give you more space, I personally, I like bullet points myself because it makes things easier for the reader to be able to digest and see. And when you get to the interview, you can actually expand upon that and talk a little bit more about those things. So any other tips or suggestions for that at all?
I agree with that 100%. That's exactly what I like remember doing. Like I did bullet points for like all my hobbies. And so then when I was on the interviews, like with some of the interviews, they would say like, oh, I see you put this and this here. Like, can you explain more about that? So it kind of like opens up an opportunity for you to have a dialogue with the interviewer too, like when you do bullet points. And as Dr. Dotson here said before, like we had character limits. So we didn't really have the option to do a lot with that.
Yes, I also did bullet points.
Yeah, I think I did bullets as well. One thing I would add is, especially for the hobbies section, make sure you're prepared to talk about everything that you include there. Like for instance, I put that, I write poetry, and in multiple interviews, I was asked to like recite some of my poems and things like that. So you have to be prepared no matter what you do put in your section or anywhere in your application to really be able to expand on that, talk about it, or even give examples if it's something that could be performed on the spot.
Yeah, Derek, Dr. Carter was this close to asking me to perform for him during my interview today, but we were already at the end of the day. We were a little bit behind. But let me tell you, I came prepared. So I have another question in the chat here. One of our students wants to know about away rotations and just tips for being successful on your away rotations, et cetera. So to our panels here, did you guys do away rotations? You don't have to say where in particular, but just talk about your experience, or if you have students who are rotating at your current program, give advice for, what makes a good student for away rotations.
So I didn't do away rotations. I was at Howard and I did both of my rotations there. And I wish I would have been able to do away rotations so I could see how other people do consults or run clinic. And I definitely recommend for you to do away rotations, but now with COVID, I'm not sure if that is even an option. But definitely it has its advantages. And looking at students that are rotating in our department, we definitely want to see a student that is involved in the clinic, involved in the consult service, involved during call. We don't want a student that comes and is sitting in the corner doing your work questions. That's definitely not what we want. We want someone that is involved and ready to learn.
And for me, I actually didn't do any away rotations either, mostly because I didn't have the time, since I kind of found like ophthalmology late. So I was like more so like in my home department, but at Einstein Montefiore, so we actually have 3 away rotators right now, aside from like the Einstein students at our program. And so I would say just like some suggestions for if you do end up doing away rotations. Number one, do the same things that you would do at your home program. So like if you're like researching patients for a particular attending you'll be with like during that day, like familiarize yourself if you're able to do that. If you're assigned to be like in the OR with an attending, because like, for example, like I'm in the OR tomorrow with an attending, but I know there will be med students with us. Like if you haven't seen like a cataract surgery before, something like that, maybe look at it like the night before, something like familiarize yourself so that like when it's happening live, things won't be too foreign to you. And then you can ask like appropriate questions or like thought-provoking questions based on like what you're seeing. When it comes to like doing things during the day, as everybody's mentioned, just like be eager, be like willing and ready to help, be on time. I think that's like probably the easiest thing that you can do as a rotator, as a med student period, is like being on time. So those are probably some of the tips that I'll probably give.
Yeah, I didn't do an away rotation either, but I would just add, just like everyone else mentioned, really being motivated is one of the big things. In terms of kind of getting some of that knowledge, since you don't have a lot of exposure to ophthalmology in med school and may not know too much about it, one of the good resources I used was the Opto book. It's like a very I don't want to say like dumbed down version of ophthalmology, but it's presented in a way that's like very readable and things just kind of make sense, and it's in like pictures, and there's a lot of videos online, and it's a free resource if you just access it through their website, and it'll give you a good strong foundation for approaching any away rotation or any rotation you do in ophthalmology.
Yeah,
So
wonderful.
I did, I did 2 away rotations. I did one with the Shields in Philadelphia because that they're ocular oncologists, and that was the kind of the crossover between radonc and ophthalmology for me to determine sort of which way I wanted to go. And then I did another one at a nearby institution that I thought that I liked. I would say don't just do any old away elective. Try to do it somewhere where you really want to go. If you know someone, again, through the Rab Venable program or the MOM program, and you could rotate with them, that may be a good place to go. You don't just want to go and sort of be a bump on a log. Like, you want to go and you want to make a difference. I know our program, we really try to train our AIs to function as like very junior residents, so that when they go on OAs, they can examine patients and refract and check pressures and be helpful, which I think is impactful when they go and rotate places. I've had people call me and say, "Oh my gosh, your medical student is here and they're so good." And I'm like, thank you. And so, you want to be that person that they call me about and say, this person rotated with us and they were really good. Also, if you know someone or you have a mentor or a connection at a place, it can be helpful to contact them beforehand and say, "Hey, I'm coming in." When I was at the Shields, for example, I worked on a research project, and I literally did nothing but work there, rotate there, eat, and research the whole month that I was there. Like, day in, day out, that's all I did. And it was published in Ophthalmology, it was like a major publication. So if you come in knowing that you're gonna just completely work your butt off, and you come in prepared to do research, and you let them know you want to do research, you can really get a lot out of it. You can get letters of recommendation out of it, which can help, especially if your program is smaller or less well known, or if you don't have a home ophthalmology program. But you really have to be, prepared and to work and to really get after it for that. I had this book, and I don't even know where I got this book from. It says ophthalmology, but I carry this in my little white coat pocket on every rotation. And you can see I've still got like tabs and writing in it. And I would just take copious notes. Every patient that I saw, I would make a note, and then I would go home and read this book. And so, it's really just about, again, the motivation and the dedication, and the just really being persistent about trying really hard to make a good impression on away electives. You don't want to go do an away elective and then be really not memorable in any way. You want this to be a memorable opportunity where then when your application comes up, the committee's like, "Oh yeah, they rotated with us. They were really good." That's what you want to happen. So whatever you have to do to get there is what you need to be doing.
Yeah, so for away rotations, I believe that if you do not have a home ophthalmology program, you are typically taken as a higher priority. We are taking away rotating students here at Iowa, and if you do not have a home program, you are absolutely taken as a higher priority. But yeah, for away rotations, take advantage of every single opportunity that is given to you during those aways. I did 2 away rotations. I did 1 month at Duke. I did 1 month at Mass Pioneer. At Duke, I established a very strong mentorship with Mike Quist. He's currently a glaucoma fellow at Duke. He's like my big brother. He looked out for me the entire month. But I worked my butt off. When I saw things in clinic that were interesting, I took the initiative to say "Oh, this is cool. I'm going to write up a case report on this." My attendant was like, "Okay, yeah, sure." Next day, on her desk and everything. From doing those away rotations, I was able to establish and get letters of recommendations as well. So for some people, some people are going to say that they are for doing away rotations. Other people are going to say you may not need to do them. But either way, away rotations can either make you look very, very good, or if you're not performing, or if you're looking like you're not interested, it can look very bad upon you because the spotlight truly is on you the entire time that you're there. So I'm trying to go through a few other questions here in the chat. So there's another question here that was asking, well, how many programs should I apply for? Where should I apply for? General stuff like that. And I know that things are a little bit different with COVID, and I believe that we're still going to be doing Zoom interviews this cycle. I mean, I personally, I don't like Zoom interviews. I love doing the in-person interviews and traveling and to see programs and meet people. Like that's where I met Derry. That's where I got to see Belinda again. But I may not be the best. I may not be the best one to answer this. For me personally, I was very scared when I applied. I'm not gonna lie. I applied to just about every single program that I could because I didn't know how well I was going to do. There are scholarships that are out there that are available for minority students. One is the Dr. David Kearney and McDonough Scholarship. It's $5,000. It's given every single year. Very few people apply for it. So I'll try to find the link and put it in the chat. But yeah, any other suggestions for how many programs people should apply for?
Yeah, I think I applied pretty broadly as well. I think especially in the era of doing Zoom interviews and not having to travel, you're saving some money there. So I think it probably makes sense to apply a little bit more broadly. And I'd imagine that's what a lot more people are trending towards just because of the decreased cost. So I would say if those are programs that you're interested in going to, I mean, definitely don't apply somewhere that you would never go, because if you match there and you don't want to be there, you're going to be miserable. So as long as they're all programs that you are willing to go to, then I would say apply for them.
Yeah, when I applied to a lot of places because I was scared of not matching because Ophtho was just that competitive. And now, you know, you can get, it's easier financially because of the Zoom interviews, but there are limits on the way that you can schedule Zoom interviews. And there might be a limit on the number of interviews you can schedule this year. I don't remember exactly, but they're changing the way that you can pick your interviews because everything is virtual and they don't want people just like taking advantage of the system. So just keep in mind that there are going to be some limits. I had like a mega spreadsheet of all the like potential interview days, and you guys probably already know there's like a Google sheet and like a student doctor, and like that first person gets the interview and is like, interviews are out, and then everyone's like checking their email, like, you know, you scratch off the ones you didn't get and you circle the ones you got, and you're like playing Tetris trying to get them all in. So you know, it can be tough to schedule all the ones that you want. But, you know, like Dr. Ansa said, if you don't want to go there, don't apply there. If you would rather go there than nowhere, then sure. But like, know that that's an option. There were a couple of places where I was like, I really don't want to go there. Like, I really just don't want to go there. It's too far away. I didn't apply to California programs. I'm an East Coaster. I'm not going to go to California. I'd be miserable in California. Like all my family's here. We're super tight. Like I see them all the time. My brother came by today. Like, no, like I would be awful in California. And so I didn't apply to California schools. I stuck my, you know, I had like a rule where if I can get there with a direct flight or like one connection, then it was worth it to me, because then I could go home for the weekend and see my family when I needed to recharge. So, you know, think about those things too, and don't necessarily exclude anywhere because of that, but it is something to consider when you're applying. You know, don't just shotgun everywhere because you can. You do want to be a little bit thoughtful about where you're applying. Okay, I see interviews are capped at 18. So yeah, you can apply to a bunch, but consider you're only going to get 18 interviews. So do you really need to apply to that many places? And some of it also depends on your step scores, if you have them, and the strength of your other parts of your application. You know, somebody with a really high step score is probably going to get more interviews straight off the bat than somebody who has not as strong of a step score. And so that not as strong person may want to apply to more programs.
All right. Are there any other questions here? Either you can put them in the chat or you can speak up here on Zoom. Any other questions at all?
I put 2 book resources in the chat that are common books that we give our medical students to learn about. So check those out, and I'm going to put my email in the chat. If anyone has any other questions, feel free to email me. Happy to talk with you about, you know, applying or whatever. So feel free to reach out.
All right, you guys.
Sorry, one last thing. In terms of interviews, try to make like an idea in your mind of the things you're going to say, at least of a few questions. Tell me about yourself. Why ophthalmology? Because almost, I guarantee you, in most interviews, they're going to ask you, why ophthalmology? Tell me about yourself. So have something in your mind that you don't have to be thinking about it. And just the fact that it's Zoom, don't take it lightly. They're looking at you and the way you convey yourself. So try to dress appropriately, good lighting. I think there's tips on the internet on how to do a good Zoom interview. Sometimes when they're interviewing some applicants, they may have you in the waiting room area, and they're definitely also looking, does this person interacts with the other people that are waiting? Are they not saying anything? So don't take it lightly, and definitely be aware of how you're conveying yourself during the interview.
And I did put a question in the chat. I was just wondering, is that capped at 18 for Zoom specifically, or is that all interviews? Excuse me.
All interviews are Zoom this year.
Oh, I see.
Yeah, so all the interviews are Zoom, and then the programs have the option of doing a real open house in person after the interviews end. So we don't want it to be something that, like, you know, potentially could hurt you or you think could hurt you. So there are open houses in like late January or February after all the interviews are done, where you can go in person, and it's before your rank list is due. So that may affect your rank, but it won't affect our rank because we will have already submitted our rank list at that point. So it's Zoom interviews for everywhere this year.
I see. And I just had one follow-up question to that. Do you foresee programs kind of continuing along this way over the next couple of years, or do you see a switch back to in-person?
Switch back to in-person. I think it's a much different experience, getting to know someone in person, making the eye contact and seeing them sort of in real life versus over the Zoom. So I think that's important. And it's also important for you as an applicant to go to the place, to see and interact with the staff and the residents. And, you know, it's easy on both ends to sort of paint a rosy picture over Zoom. But you really get a feel for a place when you go there. And you also, you know, you have to spend time in the city so you can realize if the city is somewhere that you like, and things like that. So I definitely think it will move back to in-person.
That makes sense. And I'm just realizing now I was at the AAMC Ophthalmology program, and I connected with you. So it's nice to see a face to a name.
Hi.
Nice to see you in person, Dr. Dicendo, or over Zoom rather. But thank you, appreciate it.
All right, y'all. Are there any other questions for tonight at all? Well, all right, you guys. For our panelists, are there any other pieces of advice that you would give to our applicants getting ready to go to cycle, our aspiring applicants for next year, et cetera? Any advice or words of wisdom you would give to them?
I would say try to, especially going into the application season, those who are submitting or have submitted their applications, try to be as organized as possible, you know, making spreadsheets of all the programs that you interview at and all the places you apply, just to keep track of things, because it can get a little overwhelming once a ton of emails are coming in and you go on multiple interviews and you're trying to figure out at the end of the day what you want to rank all these programs as. So taking little notes after every interview to kind of distill what your gut feeling is on each of these programs is going to be really important when that time comes near the end, when you're making that final list.
One thing I'd probably say is that like at the end of the day, you are your best advocate. So when it comes to like the interview time, make sure you're putting your best foot forward, like review your application the day before you actually have your interview, so you're not surprised by any questions that you get. And even like going on like with the like interview process, if you need to practice like doing a mock interview with yourself, be like recording on a screen, feel free to do that, because you may have like different nuances and like hand motions, as I'm doing now, like hand motions or like saying ums or ohs. A lot of times that can be distracting for the people that you're talking with during the interview time. So definitely put your best foot forward, be your best advocate, and like practice if you need to prior to the day where it's like time for you to shine.
Yeah, and for me, I recommend to just be yourself. Usually try to ask a good question at the end of your interview to show interest in the program, and try to research the program before your interview so that you can ask good questions during the session.
Yeah, I was going to say be prepared, which I think everyone has touched on in a little bit of a different way. But like Lynette said, read up about the program, like know what they're about before you show up at the interview. Be prepared with your Zoom interview tips, get a ring light, face a window, elevate your computer so people aren't looking up your nose, all these little things that you can Google. Be prepared when you're submitting your application, know when it's due, know what's due when, be on the lookout for secondary applications. Like we said, be prepared for the questions in the interview. There are like several sort of stock questions that everyone asks. So like write out answers. I hand wrote and like typed up paragraph answers for all of mine. I didn't memorize them because you want it to sound natural, but I wanted to be like, okay, I've thought about this. What am I going to say? So, be prepared for that. If you're going on away electives, be prepared. Be prepared when you ask people for your letters, just like at every step along the way, be prepared for what is going to get you the best bang for your buck, and just really focus on that next step and being ready for that. So.
Yes, indeed. I think that my last piece of advice would be, although applying for residency, interviewing for residency can be a very stressful time, remember to have fun with it. Remember to enjoy it. You're going to meet many people via Zoom as well as on your open houses that you're going to be connected with for the rest of your life. I already know that I got Derek, I got Belinda, we in this together through and through. And when it comes down to making your rank list, I know it's a little bit further down the line, but follow your heart, follow your gut. If you're having trouble going between your number one, your number two, pick the program that you feel like you're going to thrive at and that it's going to make you into the best eye surgeon as possible. So yeah, I want to thank each and every one of you all for taking the time out tonight to be here this evening. Thank you so much to our panelists for taking the time to be here as well. I really do appreciate it. I'm sure our applicants do appreciate it. I'm glad that this is a recorded session, so we'll be able to get this to other students who were not able to be here tonight. And yeah, go forth, prosper, do as best as you can. And we have our emails in the chat, so feel free to reach out if you have any questions or concerns or just need someone to hype you up, to give you a pep talk. All right, you all have a wonderful night and look forward to seeing you guys all again in the opto world.